Thanks, Christine. Medicare open enrollment is happening now through December 7th, and there are only a few weeks left, so we want to get you all the information that you need. We're joined by Josh Kremley with Health Markets Insurance Agency to break it all down for you. Josh, good to see you.
Hey, good to see you too. Thanks for having me.
Yeah, we always see that email that's like, open enrollment is here. So
yeah.
we have two ones to talk about. We have Medicare, which is important, and that's the most urgent of the two right now.
That's correct. That's right. So we're about 16 days out from the annual enrollment period ending for our 65 and older folks. And there's been a little bit of disruption in the market. I don't know if you've heard United Healthcare and Prisma are kind of in negotiations. They haven't come to an agreement yet. So we have a lot of folks out there kind of looking for their plan B in case that doesn't happen. So, we're trying to give people here locally somebody to call and work with in case they need that help.
Because what would that mean? Some people may be catching that and being like, wait, what? What does that mean?
Yeah, so what it means is if you have, if your doctors are with Prisma and you're currently with United Healthcare, potentially you have a choice to make, right? Find a plan that covers your doctors or stay with your plan and be out of network with your doctor. Yep, exactly.
Network, so.
Yeah, talk about your approach at Health Markets. Like, how do you guys help folks through this whole process?
Yeah, so what we do is generally we kind of make sure that they have the most cost-effective plan for their medications, make sure their doctors are in network, make sure that they get enrolled properly, and it's a smooth process. Educate them about what their plan's going to cover, what it's not going to cover.
Because it's complicated. It can be complicated
for
folks that don't understand exactly what you're clicking on.
There's a lot of letters. It's like, HSA or this and that, and you're like, how do you know?
What is a health savings account?
all the letters, yep. So we try to break all that down. So that there's no surprises when January 1 hits and you're moving forward with your plan for the remainder of the year.
So what is a person watching? They're like, okay, I really would like to call Josh and just be like, would they show you maybe what their plan was last year? Do they need to know all their doctors so you can see, are they in network? Yep,
so we get, when you call into the office, my assistant, Alyssa Blue, she'll get, just your basic information, where you live, learn a little bit more about you, obviously medications, doctors, and then what we do is we go research and try to find the best fit for you.
And then moving into like health insurance, and we're all going through that right now here with us, trying to figure out exactly which plan works for you. So some of the other folks, same process of calling you and saying, hey, here's where I am. Let's take a look at my lifestyle. Here are some of the things I want to be able to accomplish.
Yep, great question. So that open enrollment ends December 15th for anybody that's trying to start a plan that's going to start January 1st. And so if you've ever dealt with the federal marketplace yourself, it can be very confusing. There's tax credits involved, and if you don't understand what you're doing, it could end up costing you come tax time the following year. So with all the plans that are available, trying to find the best fit for you, not necessarily looking at the one that has the lowest premium, but one that's going to, again, cover your meds and work the best for you.
Because there's so many things to think about. Are you putting your whole family on it? Is it just you? Are you having any upcoming surgeries that you already know about?
Yeah.
Because then you would do this one versus
having a baby.
Right.
Yeah, there you go.
It's stuff. It can be overwhelming. But y'all make it so much easier. And sometimes it's just nice to have someone to bounce ideas off of.
Yep. That's what we're here for. That's what we're here. Try to make, life's complicated as it is. This shouldn't be the most complicated decision you have to deal with during the fall time.
Especially when we have someone that deals with it all the time.
That's what I do day in and day out.
Someone on our team. So where are you located? Can people just drop by?
Yeah, we have a brick and mortar location at 409 Mills Avenue. It's Suite 204.
Well, it's right near us.
Yep, just right down the road. Or you can reach us at the office at 864-999-1384.
All right, call that, guys. Again, I hate to make any anxiety, but time is kind of ticking.
It's that one thing that you have to do. If you miss it, then you missed it.
Absolutely.
Yes.
Thank you, Josh.
Thank you, Josh.
Hey, thank you for having us. I appreciate it. Happy Thanksgiving.